But to work on the hyperkyphosis symptom, we always check with the packing here. We have like the muscle, we should check to see like how is the tension there are on both sides. Go down to anterodeltoid. Some patients, they have very high tension for the headache because of this muscle, the scalene muscle, SCM is gotten short. And when it's short, it will make the head like that. And on the muscle on the behind of the client is getting longer. It's pulling down on the muscle behind of the suboccipital. That's why the patient, they got headache. And always they come and they will complain about like they got headache all the time. After any session, it helps them feel better. But just only 1 or 2 hours later, if they did not drink enough water, they will feel the headache is coming back. So that's why we always recommend the client like drink water. That is help a lot for the muscle staying hydrated. I'm warming up the muscle for the patient first. Yeah, we have the big high tensions along this clavicle here. So I will go to stretch this muscle to have the muscle getting longer. Because when the hyperkyphosis is appear, the symptom that make the muscle getting shorter here and very strong. That's why the posture always like that. So now we have the client up on the shoulder. It's help they getting be normal. How is the intensity for you?
That's good.
Yeah. From 1 to 10,
Like a 7.
Perfect.
Mm-hmm.
That's good, that's good. So I will pushing down the packings here, and I will ask the patients to adapt the arm. Can you adapt the arm with deep breath? Adapt.
Abduct?
Yeah,
Oh, it
abduct.
sounded like adduct. Sorry.
Abduct, yeah.
But how far do you want them?
Okay. Up until when you could not do it. Just stop there with deep breath.
Until I can't do it, I'm going to give you a hug.
Oh, yeah, that's nice.
I have really good flexibility in my shoulders.
Okay, relax. Yeah. That's good, that's good. Relax. Okay, you can relax. Thank you. So let's just pay attention like when the client, they try to do the abduct over the normal. After that, they could not relax. So we make sure like just do enough and they feel like it's tender there. Just stop and take deep breath. Breathing is helpful increasing the oxygen to the blood flow, and it helps the blood flow go through to the high tension muscle. So, yeah. Yeah. So we find out one tender part in here. Someone who look at it here, we can see the tender part. Okay, we are looking for tender parts. It's connective tissue direct to enterodeltoid. Be sure when you work with the patient, our body mechanism should be like that. Which one, who is like, which side is dominant side, just step up that side. Because if we do like that, we will become hyperkyphosis later. When we have the client and then it's all the symptoms sent to them and sent to us. So pay attention when we work with the body mechanic like that, yeah? Yeah. So look like he has high tensions on the connective tissue between the pec low to anterior. On the left side is more than on the right side. We start to twist on the left side first for him. Yeah. We have a lot of technique to release the high tensions on the connective tissue around this shoulder. But I will show you today like with my size smaller than my patient. So I will work on this like that. I will open the patient arm. Make sure like we holding below the wrist. Don't holding in here. It's we pulling out the muscle around the wrist in here. It's not good for the patient. We make sure we're holding it on this area. So now we check this one to see. Okay. I will try to open my patient arm. It's like one we pulling down like that and another arm we shaking like that to make sure we will not give very deep pressure to the shoulder because on the jaws is in here. If we give very deep pressure like that, it will make the shoulder is unplaced. So it's very important like we give enough pressure and shaking. Deep breathe. That's good.
So are you sitting under under or on the top?
That's it, under the subclavicle
So
here.
you're under the subclavicle?
Yeah.
Okay, so you're not under like the armpit?
It's like I give the pressure under the subclavicle here because they're losing the high tensions the pec minor and pec major here. So we go under here. We don't give direct the pressure go direct to the clavicle because it will block the bone. It's very important. So we make sure like deeply. Yeah. There are 120 points in here. You can feel like our shoulder between the pec is connective tissue direct to the anterior deltoid. It always have a big tender points. When you touch here, we can feel like it's very tender. And when you feel tight on the shoulder, that's muscle is getting shorter. So when we open the arm, we always feel, it's painful. So thus we should release the high tension. HEP is increasing elasticity for the muscle because only our jaw, when we walk, is always like that. So now we release the high tension. Stretch for is getting longer, and we will feel it's better. So for the treatment, like some patients, they don't know how to do stretching, and they got very high tension. So our job, we should do like have the client getting release the high tensions on this area. So are you comfortable when I work in this area for you?
Yeah, that's fine.
Okay, that's good.
I don't care, but she doesn't like to be on the film.
Sometimes we go sliding along the deltoid here. If you feel like some area is stuck, you cannot go deeper because when you go deeper, it will make the client getting some bruise after that. We're just keeping the same pressure, but we shake. Shake is like we have the fibers, contractures, getting some vibration to release the high tension so we can go through that. And it can help the client feel like the high tension is unblocked and the blood flow can go through that area. Yeah, it's softer now.
Mm-hmm.
Remember, all the pressure we give to the client, it always goes to the muscle. And pay attention, the clavicle is very sensitive area. Yeah. I'm using my thumb, go deeper to the pec minor here, and laying the shoulder. Okay. So now I'm done with the back and anterior deltoid. I'm going to work along the SCM, scalens, and levator scalp and spleen. Someone can see like in here when the shoulder is getting released, the high tension is getting lower than on the right side. The left side is lower than on the right side because the muscle is released already and it's getting longer. It helps the patient feel relaxed, so they will not contract the muscle anymore. It's just going down like that. And this area we did not work in yet, so that's like it's still higher and the muscle getting still stay like shorter and getting very strong. You can see that? Yeah. So now I'm going to work on the SCM. Someone have the question? Any questions? No?
Mm-mm.
So as I talk about like headache symptom is very common with the person they have hyperkyphosis symptom because the muscle on the SCM, the scalens and levator scalp is getting shorter. So that's why it's make all the muscle behind the head is here is getting very strong and it's pulling down all the muscle behind the head here. We are going to release the high tension this area. One technique we can do for the SCM, I can show you like we pinch the SCM. Yeah, pin but with like light to medium pressure, but not like really medium, it's firm pressure. We pin like that and go. Sometimes I can do on both sides, which like pulling up. And ask the patient, open your mouth deeply. That's good, close your mouth. So now try like in by mouth, out by nose. Open your mouth, close your mouth. That's good. Yeah. With this technique is help the muscle like is when the client they getting oxygen by mouth and they close the mouth out by nose, like giving more pressure for the blood flow can pump up and go through this area faster. So this SCM is released. So now we are going to scalens. We have the scalens here. So when we work in this area, it's very sensitive area. When I work here for you, you will feel it's like some tingling go down to your forearm. That is normal.
Okay.
Okay. So before we do stretching for the scalens, we should turn the head like ear to the shoulder to give more space for the pressure. And after that, we use this 3 finger. Give to place to the scalens and ear to the shoulder. And after that, stay in that area. Ask client deep breath. That's nice. Very good. So now open your mouth deeply. Very good. And relax. How is intensity for that for you?
Oh, it's like an 8.
Oh, I'm sorry.
No, it's fine.
Okay. 8 is a 9 number. Yeah. Yes, sometimes client feels like it's hurting them, but that's the feeling. Like after that, it feel better because we can feel the high tension is getting losing. After when we release the finger here. Okay, now I'm going to work on the levator scalp. We have levator scalp here. We do stretching on this area for our client too. We have 2 ways to do stretching. One, we use with 2 hands, pushing on, like crossing your hands like that, one on the shoulder and another one along the neck. So now open your mouth deeply. Very good. Okay, I should do on both sides for you. When I turn the head, I always use my forearm to turn my client head because if like my hands, I have oil, so I cannot use my hands in touching to the head like that. It make them feel like some patients they are very difficult and they don't like it. So that's why we just turn it like that to help them feel like we pay attention. Okay, so I'm working to stretch on the scallops on the right side. You can see this here. The pressure here. Turn the head on this side to get in deeper. Open the mouth deeply. Exhale. That's nice. And relax. Yeah. So, stretching. Sorry. Open the mouth deeply. That's good. Remember when we give massage to patients, we can give very deep pressure around the levator scalp, but around the neck, pay attention. That is the area, it's very sensitive area. Even we use with hot stone or any technique, if we give deep pressure here, it can be affect direct to the nerve system. So that's why we pay attention. And the skin on the neck is very like sensitive as well. Okay. Yeah. So now we work on the suboccipital here. We give some palpations. How is the pressure like that for you?
It's great. It's a 7.
Okay, nice. Okay, take deep breath. Yeah. Some acupressure points under along the cervical, around the C1 and C2, that can help to activate the blood flow. Sometimes when the muscle getting tight, it will block the blood flow. That's why the client, they got headache. So we can give some acupressure points around here. That help them feel like nice. Okay, I'm done.